saw a user on Threads post this question out to the worldwide universe to see if she could get some answers about having a headache in pregnancy. And I thought, I'm pretty qualified to answer that. Let's put out some information about headache in pregnancy. I'm Dr. Monica. I'm a board certified OBGYN and mom of 3, and we're going to go through headaches in pregnancy, the different types, concerning signs, and then some treatments you can or shouldn't do to help treat yourself. And stay tuned to the end for some important red flag symptoms that you need to know about and you need to know to go to a doctor to if you experience them. So when it comes to headaches in pregnancy, there are 2 different types, primary or secondary headaches. Primary are just that they are just a headache all on their own. So these are things like a migraine headache, tension headache, cluster headache, which tends to kind of cluster itself in one spot, often behind one eye or the other. Oftentimes in pregnancy, we're going to see either migraine or tension headaches. Now, the other type of headache is a secondary headache, and that means that a different process is spurring on this headache and causing it to occur. So these can be things like elevated blood pressure, preeclampsia, different neurological events. Those are where something else, another process, is causing the secondary headache to occur. Now, migraines are very common, and they're very common in women. It's been found that estrogen fluctuations contribute to migraines. Now, this is evident when you look at where they occur. Migraines occur in only 1 out of 16 men, but occur in 1 out of 5 women, and they peak in the reproductive years when estrogen levels increase and change instead of being stagnant in pre-puberty and menopause. So as one can imagine, pregnancy, where estrogen and all the hormones are kind of changing, is often a time where we do see headaches, although estrogen increases in the first trimester and then becomes a little bit more stable in second trimester, so we'll often see that headaches improve once we get into and towards the end of the second trimester. So when we talk about treating or avoiding headaches, we go into first simple things like lifestyle changes. So when we're talking about these headaches in pregnancy, for now we're going to talk about primary headaches. So that means you just have a migraine, a tension headache, or a cluster headache. First line treatment that has no risk is lifestyle modifications. So this means avoiding things that are known triggers, trying to make sure you're getting enough rest, which gets pretty tough, especially towards the end of pregnancy when you're uncomfortable and it's really hard to sleep well overnight, but doing your best to try to get as much rest as you can to keep from being sleep deprived, which can be a trigger for migraines. Making sure you're adequately hydrated, so getting a lot of water. Hydration is very important and very difficult to get enough of when you're pregnant. And then different relaxation techniques that may work for you, whether it's aromatherapy or yoga or exercise, things that might make you feel more relaxed and hopefully help either prevent headaches or help to make one that's already present ebb away. Now, the first line recommended treatment for a headache in pregnancy is Tylenol, 1,000 milligrams. We know there's been a lot out there lately about Tylenol, but Tylenol is still recommended by ACOG and still considered to be safe. Please see my video in the description below for more information on that. But that is the first line recommended treatment for a headache in pregnancy. Second line recommendation is caffeine. Now, this also might give you a little bit of a red flag because I'm sure you've heard about caffeine not being safe in pregnancy. So caffeine is safe if it's used at a low amount. So the cutoff is 200 milligrams of caffeine in a day. Using caffeine over that level has been associated with increased risk of miscarriage. So if you're in the first trimester, you're having a headache, you've tried your Tylenol, it's safe to try some caffeine. If you look at the amount of caffeine in a serving on, if you're having a cup of tea or a cup of coffee, usually these are somewhere in 30 to 65 milligrams of caffeine. So usually it would be safe to have 1 cup of coffee if a little bit of caffeine might help you with your headache. Now, I would caution you against using the medicine Excedrin. This has Tylenol and caffeine, which sounds like it would be good for us, but it also carries in a large dose of aspirin, which we wouldn't recommend that you take. And as a third line treatment, you can also try some Benadryl. Benadryl is an antihistamine, it's an H1 blocker, so this can improve headache symptoms and it can also help with nausea. So if you're in the first trimester and you've got a headache and you're also having some morning sickness, Benadryl might be something that can treat both of those. Now, of course, the side effect is that it can make you a bit sleepy. So those are the first line recommended safe treatments for headache in pregnancy. There are many other medications that are prescription only that you'd have to talk to your doctor about. One medicine I did want to talk about is magnesium. So magnesium is a supplement, it's over the counter. This is sometimes used as an alternate treatment of headaches. Now, the reason it warrants some discussion is that there was one study that noted a possible increase in fetal demise with use of magnesium. However, the study was looked at again and it was found that there was more likely to be an association with a congenital birth defect that had caused the fetal death more so than the magnesium. So the study wasn't very solid. Repeat studies didn't really prove it. And then in the world of obstetrics, we use magnesium a lot. There are many indications for magnesium and there's not really been any adverse outcome associated with it. So So given that it's used in many other situations without any evidence of harm, it's a pretty reasonable alternative option to use to treat a headache in pregnancy. Now, things not to use. First one that people might think to reach for is any type of NSAID. So NSAID stands for non-steroidal anti-inflammatory drug. This is anything like Motrin, Advil, ibuprofen, Aleve, naproxen. These medications are not safe to use in pregnancy. Now, with that being said, you may hear stories, or you may, if you're someone who is a really severe chronic headache sufferer, be given a prescription for like an ibuprofen or a Motrin in the second trimester. But this should only be done by a physician. And even myself, I will usually have a maternal fetal medicine, so a high-risk specialist, evaluate if that seems appropriate for a patient. So the point is that there are times when this is used in extreme cases, but that is not a medicine that anyone should use outside of a physician knowing about it. Other things not to use is any type of opioid medication. So a friend has a hydrocodone laying around and you have a bad headache. Don't use the hydrocodone. These are things like hydrocodone, Norco, oxycodone. These have opioids in them, which are very addictive. And not only can a patient become addicted, but a baby can become addicted too if it's used long term. So we do not recommend using these type of medications for really much of anything in pregnancy unless it's prescribed by a doctor. So finally, I wanted to go through a couple of red flags about headaches that you need to know about and you need to bring to the attention of a physician if they happen. So the following symptoms I'm going to tell you about are indicators that you might be having a secondary headache, meaning that something else is going on that's causing you to experience a headache. So the first one is something called a thunderclap headache. And this is a term because of how rapidly this headache comes on and how severe it is. It feels like there's a clap of thunder in your head. So if you're just fine and then out of the blue, all of a sudden super acute bad headache comes on, that's something to tell your doctor about, versus one where you start to feel a little bit of achiness, things get worse as the day goes on, turns into a migraine, turns into a headache. That's what we normally see with headaches versus that sudden, very acute, very severe headache called a thunderclap headache. If you have a headache and you're in the third trimester, it's always a good idea to check your blood pressure. Now, we'll have headaches that aren't related to preeclampsia, aren't related to blood pressure, but the first way to find out if that might be what's going on is to check your blood pressure. So if you have a headache come on and you check your blood pressure and it's high, meaning over 140 over 90, that's something to call your doctor about or even go to emergency room for. If you have a headache and you're also having blurry vision, if you're having any type of neurological deficits, which is a pretty broad term, remember your brain controls everything in your body. So a neurological deficit can be many things, but if you have a headache and you also have tingling in an arm or a leg, or you feel like you can't move your body appropriately, or anything that pretty much could be associated with your central nervous system, that's something to call about. If you're having any altered consciousness, so you don't know what time of day it is, not sure where you are, feeling disoriented, that's something to call about when you have a headache too. Pretty much call about that anyway, that shouldn't be happening. And then if you have a headache and you're also having vomiting or you're having a fever, those are things to call about. Now, of course, use some discretion on that one. So if you're in the first trimester, you have morning sickness, you're vomiting anyway, and then you have a headache, maybe that might take a little bit of the concern out because you already had that present. But if you have a headache come on and you have vomiting come on and they seem to kind of coincide, that'd be something to call about. And at the end of the day, if these things come up and you're not sure, you can always call and talk to a clinician and see if it's something you need to come be evaluated for. So that's a rundown on headaches. They're super common to see in pregnancy, and most of the time they're not significant to be anything serious or harm to the pregnancy, but there are times that they can be. And the fact is that they make your life kind of miserable. So having some options for treating at home to help improve your quality of life are great. And then also knowing warning signs when you need to call and consider seeking further evaluation is also important. If you found this information helpful, please drop a like or consider subscribing because I do talk about lots of OBGYN topics. Otherwise, I'll see you next time.